All right. Hello, everybody. So, as promised, I have a case study here for you. Um, and just before we dive into this, I just want to give you guys a little background here. So, very long time ago, I was pre-vet. I was interested in going to the medical field, just like so many of you in Bio 162. And so, I have been a vet tech for about 10 years. um, and so anytime I see really cool or unique cases, I love to apply them to the Bio 162 lab courses because it's really cool to learn about something in lab, but then it's another thing when you actually apply the knowledge that you're gaining to the real world in real life medical cases or just in general, the real world outside. So let's go ahead and dive into this. Let me get my handy dandy laser pointer there. Haha. Okay, so just as a reminder, there are going to be some explicit images here in this little presentation. I will further warn you guys when we get closer to those images. They're not right off the bat. So if you do have a problem with possibly seeing a dog in surgery, maybe close this window. I don't want to upset anybody, which is why I'm giving warning. But like I said, when we get closer to those images, I will warn you guys again so that it's not just, here's some surgery images. Okay, so let's dive into this. This is Rocky. Rocky was a patient that came into my vet clinic. And I'm going to tell everybody right now, this is not what Rocky looked like when he initially came in for his appointment. He looked very sad. When Rocky came in, he was kind of slumped over. He didn't seem like he was all there. He seemed to be really having problems breathing. So it was rapid, shallow breathing. And so when I see a patient that's having a hard time taking in air, I don't even care about the client at that point. I yell to the back, hey, we need a stretcher, get the oxygen hooked up. We need to bring a dog back and get it on oxygen. So my team comes in, takes Rocky to the back. I get some basic information on Rocky. Okay, we're a 7-year-old, male neutered Rottweiler. Why is any of this important? Well, this actually tells us a lot. So we know that Rocky is not a young little pupper anymore, even though we might think he is. He has some age on him. Further, he's neutered, meaning he does not have his testicles anymore. He's not intact. So that tells us a lot about, his hormone levels. And we'll talk about that more in a couple weeks when we go into endocrinology, but that tells us a lot right there about Rocky as a patient. And then lastly, we like to know the breed because there might be some, genetic diseases that some breeds are more than likely to get than other breeds. So all of this information is really important to know. And so I get a more detailed history on why is Rocky like this. And so the client tells me that he let Rocky out to go to the bathroom. Rocky never came back. So this client has a big property. And so Rocky, the owner went outside to look for Rocky, and Rocky was slumped over on the ground in said condition of trying to breathe but unable to take deep breaths. So we don't really know what happened. And so my veterinarian comes in and continues talking to the client. I go into the back and I want to take a look at Rocky's mucous membranes. What does that mean? What are the mucous membranes? Well, whenever we want to get an idea of blood flow in a patient or what's known as oxygen perfusion, we take a look at the gums. So the gums are your mucous membranes. And this right here, this is not Rocky. I was dealing with an emergency, so I was not taking pictures of Rocky at this point. But this is exactly what Rocky's gums look like, and this is not good. So in order for you guys to get an idea of how this is not good, let's compare this to a healthy dog. This is beautiful right here on the right. Notice how these gums are nice and pink, kind of red even. There's lots of blood flow happening in these gums, but not just that. So there's blood flow happening here, but it's that there's not a lot of oxygen being delivered to the tissues in this dog here. And so what is causing my patient to not get oxygen delivered to his tissues? Well, we need to further look into that. So this right here is what we call cyanosis, cyan meaning blue. And yeah, these gums look pretty pale blue purple. So my veterinarian talks more to the clients. We got the okay to do x-rays. This is what we see. Now, I'm not a radiologist, so I look at this and I go, it's really cloudy. Did I do something wrong? And again, I know we're not all radiologists here, so in order to really grasp how not good this is, let's compare it to a good x-ray. Whoa, right? So in this good x-ray or healthy patient x-ray here, nice image of the lungs here. We got the beautiful heart, a diaphragm that is separating this thoracic cavity from the abdominal cavity here. We can see a nice full GI tract. This patient is likely going to need to go to the bathroom very soon. We don't really see that here at all. Everything is just cloudy. Notice in this healthy patient, we can see a beautiful trachea, and here we barely see any trachea at all. And so this is what Rocky's x-ray looked like. So my doctor took a look at this and he goes, all right, let's go into surgery. And we're just kind of all like, okay, I guess we're getting ready for surgery. We have no idea why. So we prep the patient, we go into surgery. Now, told you I would warn you guys. So these next handful of slides are going to be explicit images. You won't see the full body of the dog, but there is going to be some blood. There are going to be some organs involved. So like I said, if you're not okay with it, close the window. Okay, ready? 3, 2, 1. We go into surgery. So my doctor makes a midline cut into the thoracic cavity. The ribs are right up here, and so he makes a cut just right below the base here, and he wants to take a look at what he might find, which he has an idea, but he's not telling us. So thoracic cavity. What's in the thoracic cavity? We have our lungs, we have our heart. What's in the abdominal cavity? Pretty much everything else. So your stomach, your small intestine, your large intestine, your liver, your spleen, all of that's going to be in your abdominal cavity. And then Rocky's head is up here, just to orient you guys. So my doctor takes a look inside and he goes, aha, just what I thought. What's that? Does anybody know what that is? I'm like expecting to hear you guys call out right now. That's the digestive tract. Why is the digestive tract in the thoracic cavity? He pulls out more. I'll tell you now, I did not take pictures of it, but I believe this right here might be the beginning of the spleen coming out. So the spleen was in the thoracic cavity, the stomach was in the thoracic cavity. It was not good. So in case you are not aware, you should be aware, but GI contents, your small intestine, stomach, spleen, should not be in your thoracic cavity. There is a diaphragm there to prevent that from happening, right? Well, we have, ladies and gentlemen, a diaphragmatic hernia, meaning a hole in the hernia. Not fun. So remember that the diaphragm is what separates the thoracic cavity from the abdominal cavity. So when there is a big enough hole, that diaphragm just essentially ruptured, not completely, but it was a big enough hole that all of the GI contents got sucked up into the thoracic cavity. In Rocky's case here, excuse me, the small intestine actually started to wrap around the lungs, thus restricting Rocky even more from taking in air into his lungs. But remember what the diaphragm does. It creates that negative pressure in the thoracic cavity that pulls atmospheric air into our lungs, right? So when there's a hole in there and that diaphragm creates that negative pressure to bring in air, if there's a hole, that pressure is thrown off and we're not able to efficiently breathe. And that was the case with Rocky. Now throw in the fact that there's small intestine wrapping around the lungs, it's just really good that we got to this right away, because a lot of times it's a little too late when this is diagnosed, and this can be very fatal in patients. And so things that cause diaphragmatic hernias commonly are hit by car cases, um, possibly kicked by a horse. The client did have horses on the property, although he mentioned that he didn't see any horses around when he let Rocky out, nor when he went out for Rocky. The other thing is that diaphragmatic hernias can be a breed disease, and Rottweilers are prone to having diaphragmatic hernias when they're puppies. And then as they age, that hernia gets bigger and bigger and bigger until it causes this severe problem here. So pretty intense, but this photo was taken just a couple days after sorry, not a couple days, but this was like a week after we released Rocky. He had a smooth recovery, and he did just fine. And I actually do still see Rocky today, and he's doing lovely. So good job, Rocky. And you know what? Just for the sake of this lab content, we love Rocky. All right. Cheers, everyone.